Now it's time for 3x3 Experiment by JCD. Comparing stories from ABC, CBS, and NBC. The never-ending 3x3.
We turn now to the pandemic and disappointment for many parents of young children reacting to the news of another vaccine delay. Pfizer pulling their request for authorization for kids under 5, saying they're waiting for more data. The timeline for shots now being pushed back to April or May at the earliest. The news coming as the daily case average in the U.S. has dropped below 200,000 for the first time since December, down more than 75% from the Omicron peak. But the numbers remain comparable to the highest points of the nation's previous peaks. Here's ABC's Phil Lipoff from New York.
Tonight, as COVID restrictions loosen across the country, parents of America's youngest children grappling with the news that vaccines for children 6 months to under 5 have been put on hold. Pfizer waiting for more trial data, delaying its request for FDA authorization of its vaccine for that age group for a few more months.
I think the more vaccines for me, the better. But at the same time,
wait a few more
months, if it's for safety, I think it's a really good thing.
Pediatricians, including those at Golden Gate Pediatrics outside San Francisco, now telling parents to be patient.
They understand, but, I think there's a bit of a letdown, but overall, it's better to get it right.
And if anything, this should add some trust to the general public about how thoroughly the FDA looks at all data with respect to safety and efficacy.
Last week, more than 600,000 children tested positive for COVID, but that's down from its peak of more than 1.1 million just 3 weeks ago. Depending on where you live, some vaccine requirements, even mask mandates, are going away. But health experts are warning, don't let your guard down just yet. Nationwide, the CDC says we are still losing 2,300 people a day to COVID. And there's news on therapeutics tonight to fight COVID. The FDA authorizing a new monoclonal antibody treatment from Eli Lilly that has shown promising results in fighting Omicron. 2 monoclonal antibody treatments previously that were doing well against the Delta variant shown not to be as effective against Omicron. That Eli Lilly therapy, we're told, will be given intravenously to infected patients at high risk of severe illness. Whit?
Another tool in the battle against the virus. Phil, thank you.
Walmart says that fully vaccinated employees will no longer have to wear masks unless state or local rules require it. Nationwide, new COVID infections topped 149,000 on Friday. That's down 43% over the last week. Still, the CDC reports that the virus remains highly transmissible in 99% of all U.S. counties. As Omicron fades, medical experts and politicians nationwide are reconsidering masking requirements and COVID restrictions. But some of them are clashing over the best path forward. It's a great opportunity to check in with Dr. David Agus. Dr. Agus, thank you so much for making some time for us. So, on the one hand, the number of cases continues to go down, which is great. On the other, 99% of the country still has high transmission rates. So, some states are already loosening restrictions, but the CDC is not budging on their recommendations. What should someone do if their state leaders are telling them something different than the CDC?
Well, the key thing now is not just transmission rate, it's hospitalization rate. And so when there is adequate space in the hospital, when we have oral drugs like the Pfizer drug and the monoclonal antibodies that work, we can lower mask mandates and go back to a new normal. The key is it's different all across the country, depending on what city you live in. But transmission rates are not the only metric now.
Given how many states are now doing their own thing, do you think that puts pressure on the CDC to change federal guidelines at all?
Yeah, it's difficult at the CDC because there's not going to be one size fits all. What the CDC needs to do is set parameters. If you have this many hospital beds vacant, then it's okay to go to these restrictions. And if case numbers are X, then you can go to Y. So it's going to be different depending on where you live. And it's not going to be one size fits all from the CDC.
And one big game changer we've been talking about is the vaccine for kids under the age of 5. But on Friday, the FDA came out and said they need more data. They want to see how 3 doses of the Pfizer vaccine would impact a child before making any decisions. Why is that, and how could that impact the timeline?
Well, the 2-dose vaccine had benefit. Clearly, it blocked some serious illness. But the 3 is better. You get better correlates of immunity. So that 3-dose data should be complete in the next several weeks and then filed. And I think that what the FDA wanted was to have one package, that do it once and get it so parents understood that the data were meaningful, that the vaccine was safe, and that it worked. And that will be the 3-dose shot. And hopefully that happens toward the end of March, beginning of April.
All right, Dr. David Agus, thank you.
We're back with a big change in policy for Walmart. The nation's largest private employer announced it is dropping mask mandates for its fully vaccinated workers unless state or local rules require it. Walmart made the decision after monitoring COVID trends across the country and as more states lift mandates nationwide.
You're trying to make a statement and it just looks dumb.